Hello, my name is Christopher Duran and I want to speak to you today about hip dysplasia and how it is a leading cause of dog arthritis. So the hip joint consists of a ball and socket that connects the hind leg of a dog to the pelvis, just like us. It's connected by a combination of ligaments and supportive connective tissues, cartilage, joint capsule, muscles, all that sort of stuff. The joint will rotate freely within this ball and socket joint, but in some dogs the connection is a little bit loose, and when it's loose or a laxity develops, then you get a bashing between the two parts of the joint, which leads to damage to the cartilage that will expose the underlying bone, and you will get arthritis. So hip dysplasia is pretty much that. It's a laxity or a looseness to the joint. This happens as a problem of development, and really it's a problem where in large breed dogs, mainly large breed dogs, you get a hip that is too big for the muscles to support it. This is just one of the problems that we face with breeding dogs that are really too big. And basically these dogs outgrow their hip and they can't support them, so the hip becomes loose, and when it's loose it bashes about, and away we go, we've got hip dysplasia. So breeds like German Shepherds, Labradors, Rottweilers, Great Danes, St Bernards are all classic dogs for hip dysplasia. The interesting breed is the Greyhound, where there's really been no evidence of hip dysplasia, and if you look at a greyhound, they've got these huge muscly back legs, and we think that the muscles in greyhounds are adequate to support them, whereas in other breeds of dogs the muscles haven't quite kept pace with the size of the joint itself. You can see it in small breed dogs, but it's not nearly as common. Now, hip dysplasia starts pretty early. You can diagnose it at 4 to 6 months of age in some dogs. You need to diagnose it early if you're going to prevent any further problems with the joint. If you don't diagnose it early, or if you don't decide to do anything about it early, then what will happen is you get a little dog that will be lame and sore for about the first 12 to 18 months of its life. After that, once the hip has formed and is fully calcified, the arthritis will settle down and they'll be pretty sound, pretty happy dogs in most cases, up until about the age of 6 or 7, at which stage the arthritis will set in and will start to really affect them. The causes of hip dysplasia. There is very much a genetic link to hip dysplasia. It does appear in big dogs, as we said, and there are certain breeds, certain lines that have got more or less of the dysplastic condition. So what we try and do, or the breeders try and do, is to breed out the hip dysplasia dogs that they see. And this is an admirable thing, and I encourage them to continue doing this, but it's not really as easy as it sounds, because a lot of these dogs may not show a lot of signs until they're 6 or 7 years of age, and by that stage they've probably fathered a number of litters. So the genetics of it tend to get passed down just because we don't pick it up as early as we like in some cases. You can get the dogs screened. There are certain tests that can be done to try and pick these things up earlier and breed from dogs that are known on x-rays and pen hip scans, as we call them, to be okay for hip dysplasia. So genetics plays a part in hip dysplasia, but it's not as simple as that. And we think it's about 40% genetic disease, which leaves a good 60% of other things that can cause problems for them. And the two main ones by far would be nutrition and exercise. So firstly, nutrition. If you feed your dog a lot, it will grow faster. And if it grows faster, its bones are obviously going to grow faster, and you're predisposing that dog to hip dysplasia. The moral of that little story is you don't want to overfeed your dog as a pup. You don't want these fat little roly-poly puppies. They're very cute, but they don't do so well with their hips if we're not careful. And if you keep them on the lean side of things up until 9, maybe 10 months of age, then you've probably done a good thing for that dog. The second part of it is exercise. And if we over-exercise a large breed dog, we can put a lot of weight through its hips. And at this young age, up to about 9-10 months of age, the hips are still forming and they're in quite a plastic stage, which means that they can change their shape according to the forces that are put upon them. And if those forces are heavy and are basically driving those hips into a weird shape, then you are going to get hip dysplasia with that dog. So don't run your dog around too much in that formative period up to about 10 months of age. The signs of hip dysplasia, it's really all the signs of dog arthritis, which we talk about extensively on the blog. So they have a strange gait when they're walking or running. You know, they just walk with a little bit of a slinky, wobbly hind leg gait. If you feel their legs, they've often got quite a restricted movement to their legs when you pull them around. They can have difficulty climbing stairs. They can limp. They can show the behavioural signs of dog arthritis as well. You know, they might lick at the joints. They might be aggressive. They might withdraw. They might eat more. They might eat less. Most dogs won't show obvious signs until they get older. The really bad ones may show signs at an early age, but most dogs won't show signs until they're 6 or 7 years of age. The diagnosis for hip dysplasia is through further physical examination. There's a few little tests that we can do, sometimes under an anaesthetic when we've got the hips relaxed. We can also x-ray them, and there's a particular x-ray system called the pen hip system, which is very good at picking early hip dysplasia, and it's becoming quite popular, especially amongst breeding people. The treatment options for hip dysplasia I'll cover in another video and another post, but essentially it's one of two things: you operate or you don't. The surgeries that are available depend on the age of the dog and the severity of the dysplasia, but there's a few options available. Most dogs don't have surgery though. Most dogs will cope pretty well with medical therapy. And in fact, by the time a lot of them get arthritis, that's the first thing you do anyway. If you see a dog at 6 or 7 with hip dysplasia, you don't just automatically operate on it. In most cases, you would treat it with pain relief, with joint protectors, with weight control, with moderate exercise, with physiotherapy, all the things we talk about on this blog. So there's some food for thought for you there. I hope this article has been helpful. My name is Christopher Duran. You can find more articles on my blog, and you can download my free ebook, The Dog Arthritis Survival Guide, which gives a nice overview of dog arthritis for you. Thanks for listening.